This is anterior or posterior? Anterior cranial. This one is middle cranial fossa. Middle. And this is the posterior cranial fossa. Okay. This posterior cranial fossa accommodates which structure? Cerebellum. Then we can accommodate which structure? Cerebellum here. This is the posterior cerebellum. So, can you tell me what are the different surfaces of cerebellum? Superior surface, inferior surface. What is this notch is called? You can see the anterior notch, posterior notch. This is for. This notch is for accommodation of which structure? Pons and part of the medulla. And in between cerebellum and pons or cerebellum and medulla, we can get an area. That area is called. There are so many ventricles in the brain. What is this? What is this structure? Can you tell me? This is the third ventricle. This structure. This is a part of the midbrain. Superior and inferior colliculi. You can see the inferior colliculi at the level of inferior colliculi. Here you can see two rounded structures in the cross section. You can see this structure. You can see this structure. What is the name of this structure? This is the passage passing through the midbrain, and it contains cerebrospinal fluid. Aqueduct of Sylvius. Okay. So here, through the aqueduct of Sylvius, if we make an imaginary line, then we can divide this part. One part is anterior and one part is posterior. The posterior part is called tectum. Tectum of the midbrain. শুনিয়া তাহা রইল নিরুত্তর ছবি সব নিরুত্তর ছবি কেন হ্যাঁ This is tectum and this is the tegmentum and this is the crus cerebri. So and this is the tegmentum proper. Here we can get two nuclei. You can see that is red nucleus. Acha. Now tell me, there are some fissures. This fissure is called fissura prima. Then fissura secunda? No. Is there anything? No. Then horizontal fissure. We can find so many in between small. There are so many fissures, and in between we can get some area. This area are called folium. Folium. So fissura prima. So part in front is called the yes, the anterior lobe. And here we are getting what we are getting? The cerebellar tonsils. Okay. We can see cerebellar tonsil, and here we can get flocculo-nodular lobe. So this part is the horizontal fissure we can find. Then we can get the anterior and the Middle. And is there another fissure? Posterolateral fissure. Now, what we can see here, what is this part is called? Against the nasal cavity, against the oral cavity, and against this. This is the epiglottis. So this funnel shaped area, what we call it as? Pharynx as a whole. So this is nasopharynx, oropharynx, and laryngopharynx. What are the pharyngeal muscles? What are the pharyngeal muscles you can get? Hey, what are the pharyngeal muscles we can get? Yes. শুধু কি এরাই পাস করবে? তোমরা কি কি পাস করতে চাইছো না নাকি? এরা বলে যাচ্ছে longitudinal muscles, circular. Which one is inside and which one is outside?
Longitudinal is inside, circular outside.
Yes. The longitudinal muscles are inside and circular muscles are outside. So we can get some longitudinal muscles. What is this structure? As a whole, palate. It is the hard palate, soft palate. So from the palate to the, we can get one fold. From palate to the tongue. What is the name of this fold? Palatoglossal fold. Another fold from here to this palatopharyngeal fold. Palatoglossal and palatopharyngeal folds. And what are the muscles we can get inside this fold? From the palate to the tongue. Palatoglossal. Huh? What is the name of this fold? From the palate to the tongue. Palatoglossal. From palate to the pharynx. Palatopharyngeal. So, in between what we are getting, and a fossa. Fossa means a depressed area where we can keep. So we can keep here the palatine tonsil. I can negotiate my forceps here, where I am going. This is the opening of pharyngotympanic tube or eustachian tube. So this is the tonsillar fossa. Tonsillar fossa contains which structure? Tonsillar fossa contains which structure? If it is a tonsillar fossa, palatine tonsil. Very good. We can get the palatine palatoglossal palatopharyngeus muscle. This palatopharyngeus muscle also, there is an horizontal part which actually when acts, it lifts up. We know there is a muscle which causes a lifting of the soft palate. Lifting. What are the muscles of the palate? Palate. Levator, villi, palatine, tensor, villi, palatine, palatoglossal, palatopharyngeus. So all these muscles are supplied by Which nerve?
Yes, sir.
The muscles of palate, subpalate, that supplied by which nerve? Motor supply.
Universal complex. Sir, cranial root via pharyngeal plexus.
Yes. It is supplied by the cranial accessory. Cranial accessory through pharyngeal plexus. Cranial accessory is distributed along the branches of the vagus. So, what is the nerve supply of the soft palate? It is supplied by, এই যে বলে দিচ্ছি তারপরে তুমি বলতে পারছো না কেন? It is supplied by cranial accessory now. Cranial accessory is which cranial nerve? Here go. First cranial, tell me the name of the first cranial nerve. Olfactory. The second, third, fourth. ওকে পাস করতে হবে। Which? Tell me the name of the fourth cranial nerve. At this stage, you should tell me the. You can. I can expect that you know about the origin, the course, and their distribution of that particular cranial nerve. That is trochlear. The trochlear, that is the fourth cranial nerve, supplies which muscle? Yes. SO4, that means superior oblique. So what is the nerve supply of this muscle, this soft palate? 11th cranial accessory. There are spinal accessory and there is cranial accessory. Two components. Cranial accessory through pharyngeal plexus. You will get the pharyngeal plexus within the constrictor muscles of the pharynx. And pharyngeal plexus is formed by it is formed by definitely by a cranial accessory and other components. It is formed by, there are three components: cranial accessory, glossopharyngeal nerve, and component from the cervical sympathetic ganglia, superior cervical sympathetic ganglia. It forms a pharyngeal plexus within the muscles of the pharynx. What is this part is called?
Nasal septum.
This is no. This is the lateral wall of the nasal cavity, where you can get so many elevations. What is the difference between concha and turbinate? I am saying this is turbinate. This is inferior turbinate, middle turbinate. Then I can see this, that is missing. I can see nicely the superior, inferior and the middle one. And if I can remove this one, I can area. We can get an area through which I can enter into the maxillary air sinus. Here also we can get one opening. And what is this? If I remove the middle meatus, middle turbinate, then we can get this area. It's called the middle meatus, and here we can get hiatus semilunaris. You can see hiatus, and it is covered by bulla ethmoidalis. You can see. Okay, and here is the opening of the maxillary air sinus. This is a frontonasal duct. So this is the hiatus semilunaris. So how, when we remove the middle meatus, we can see the hiatus semilunaris, where we can get the opening of the maxillary air sinus, over which we can get the bulla ethmoidalis. আমি বুলা ethmoidalis কি সেটাও জিজ্ঞেস করছি না. There are so many ethmoidal air sinuses. Anterior groove, medial groove, posterior groove. The middle groove opens where? So this is the bulla ethmoidalis. This is the frontonasal duct, through which also opens the anterior groove of ethmoidal air sinus. So these are the turbinates. We can this area, these elevations are called the turbinates. Inferior, middle, and superior turbinates. Okay. So inferior meatus, middle meatus, superior meatus, and these mucous membrane covered bones are called the turbinates. The single bone, when the bone is without mucous membrane, it is called concha. Inferior nasal concha, middle nasal concha, superior nasal concha. Here we can get an air cavity, sphenoidal air cavity. So here we are getting the area for pituitary gland, pituitary fossa, below which we are getting this sinus area, which is the this is the sinus in sphenoid bone, sphenoidal air sinus. Through ethmoidal recess, it enters into the superior meatus, or it may open into the supreme meatus. This is the ala of the nose. You can see an area here. What is the, what is the lining epithelium of this area? Pseudo-stratified ciliated columnar epithelium. Pseudo-stratified ciliated columnar epithelium. Okay. What is this? Tongue has got, what are the parts of the tongue? The superior surface, inferior surface. This is the root. There are some muscles from the this is the mandible, cut section of the mandible. Here is a genial tubercle. From here to the tongue, the fan-shaped muscle, that is called genioglossus, and geniohyoid. Hyoid one is not, I cannot find. So geniohyoid we can get. So this genioglossus muscle. Which muscle is called the safety muscle of the tongue? Genioglossus. Which muscle is called the safety muscle of the larynx? What is this? It's a compound viscera of containing tongue, larynx, and pharynx. We can get the pharyngeal wall, cut section of the pharyngeal wall, cut section of the laryngeal cavity. We can get this one. This is epiglottis. Epiglottis to the arytenoid cartilage. This is the what is the name of this fold? Aryepiglottic fold. Okay. We can find the thyroid cartilage. We can find, then we can get the cricoid cartilage. And within the laryngeal cavity, we can see this is the inlet of the larynx. It is bounded by epiglottis, aryepiglottic fold and arytenoid cartilage. Okay, so this remains closed during deglutition. So this is this area from epiglottis to up to this fold. We can find there are two folds, one fold, another fold, and the vocal. This is the vestibular fold. This is the vocal fold, and in between we can get a cavity which is called sinus of the larynx. So this part is called the vestibule. Okay. Then the sinus of the larynx, and this part is called. This is the rhimaglottis. We can get the opening between two vocal folds. It has got membranous part and cartilaginous part behind. Okay. When it vibrates, it emits sound. There are so many muscles of the larynx. From the larynx, transverse arytenoid, oblique arytenoid, then is continued as aryepiglotticus muscle. Then from the thyroid cartilage to arytenoid, thyroarytenoid, and within the vocal fold we will get the vocal ligament and also vocalis muscle. What are the tensor muscle? From thyroid to the cricoid, there is one muscle which is called cricothyroid, which changes the position of the thyroid cartilage and cricoid cartilage, and it causes tension of the vocal fold. So that is called cricothyroid is called tensor. There are some muscle which causes abduction. Okay. Some causes adduction. Almost all. Posterior cricoid, except posterior cricoid, and we know this is the cricothyroid. We can rule out. Okay. So we can get the abductor muscles, adductor muscles, tensor muscle, relaxer muscle. Tensor means cricothyroid, a relaxer, thyroarytenoid, and also vocalis. Vocalis, actually it is a detached part of the thyroarytenoid, from the thyroid to arytenoid. Okay, from the thyroid to the arytenoid. So when it contracts, there will be loosening of the vocal fold. So that is relaxer. So tensor, relaxer, abductor, adductor, and safety muscle, posterior cricoarytenoid. Okay. So we know this is the vocal process. Okay, and there is a muscular process. So when it contracts, okay, so there will be abduction and opening of the rhimaglottis. So air will enter inside. What is the nerve supply of the larynx? all the muscles, the motor supply, all the muscles of the larynx are supplied by recurrent laryngeal nerve. We know in between recurrent laryngeal nerve we can get, in between we can get, this is the continuation as the esophagus, this is the trachea. Here we can get recurrent laryngeal nerve. Okay, so it will supply all the muscles, motor supply, except cricothyroid, which is supplied by external laryngeal, which is a branch from the superior laryngeal, which is a branch from the vagus. Okay. Sensory supply above the vocal fold.
Internal laryngeal nerve.
It is supplied by the internal laryngeal. Below the vocal fold, recurrent laryngeal. We know lateral to this ariepiglottic fold and medial to the lamina of the thyroid cartilage, this area is called as Piriform Fossa. It is medially it is bounded by this ariepiglottic fold, laterally by this is the lamina of the thyroid cartilage. Above from the epiglottis to the lateral, this is lateral, this is the median glossoepiglottic fold, lateral glossoepiglottic fold. Okay. So this area is called Piriform Fossa. This is called the smuggler's pouch. Here fish bone can lodge. Here, and it is being supplied by the internal laryngeal, because we know that there is a we know thyroid membrane. This is a hyoid bone and thyroid, and it is been pierced by the internal laryngeal nerve, and it will supply this area. So here we can get the internal laryngeal nerve. So when we are removing the fish bone from this area, we may damage the internal laryngeal nerve. What will happen? The sensory supply will get affected. তাই তো? সাউন্ড হবে না কেন? সুপিরিয়র ল্যারিঞ্জিয়াল, শুধু সাউন্ডের জন্য সুপিরিয়র ল্যারিঞ্জিয়াল এন্ড রিকারেন্ট ল্যারিঞ্জিয়াল. Superior laryngeal supplies the ultimately the external laryngeal which supplies the cricothyroid. So if the superior laryngeal is affected, what will happen? এটা কাজ করবে না, cricothyroid will not act. চলো